Please welcome Dr. Sam Selimo from Boonton, New Jersey.
Good evening, everyone. What I'd like to do with this brief message is take you through my first visit with a new patient. So I'm going to have an imaginary patient here, and I'm going to have a little imaginary conversation with him or her. As they walk into the room, welcome. My name is Dr. Sam Selimo. It's nice to meet you. Have a seat, Mary, on the table. First thing I do is I do address their symptoms. I let them get rid of that ownership. I will take notes, and I would put that little chart back on my little table there. Then I inform them that I'm going to do some motion tests on them, motion palpation, and then what I find from there will clarify what's going on with them. So let's say a patient walks in, Mary comes in, she has pain in her fingers, and her neck is stuck. So I say, okay, Mary, have a seat. This is what I found. We have a block of vertebrae misaligned to the right. I do not use the word subluxation in the beginning because I want to speak to them in terms that they can understand. Misalignment can be used for anything. That misalignment is putting pressure on nerves that come out of your neck. That pressure could be formed by any type of physical, emotional, or environmental stress. What do you do for a living? Well, I'm a secretary. I sit in front of a computer all day. So therefore, your head is projected forward. You probably have a mouse, or you're on a phone. So then I'll go over and grab my spine. And I'll say, see this? This is a spine. These are your vertebrae. We have 24 movable vertebrae in our spine, and then I'll take the spine and shake it. Our spine will accommodate our ability to create function. When one of these vertebrae move out of place and become locked, that's a misalignment. That causes abbreviated function, not only in your ability to stand erect, but also it cuts off the function of the nervous system. By that I mean, have you ever seen a spine before? No. Well, I want you to touch it. I want you to feel it. This is what you have. This is the protective coating of the most valuable organ we have. Our spinal cord, which is right in the middle, that tube right there, and our spinal nerve roots. The way we function, the way we move, the way we talk, the way our heart pumps, the way we create breath, are all signals from our brain. They travel through the cord and out through these 48 nerve roots. So when you have a misalignment, that's causing functional deficiency in your body's ability to work properly. So then from there, I'll have the patient lay on the table, and I will palpate their spine, and I will address to them, this is why you're having your problems in your neck, why you're having your problems in your arm. You feel that, you feel this. Oh yeah. Now, I'm going to start at your neck. You walked in with a neck problem. But even if you walked in with a lower spine problem, I would still start at your neck. Because all life starts from the top and comes down. Our brain is our main organism. It controls every function in our body. When we're sleeping at night, we're still alive. We don't have musculoskeletal function moving until you flip over or you smack your wife. The organs are still functioning. These vertebrae, you don't have to have pain to have a misalignment. But you do have things that aren't functioning properly. Now, I try and make them understand that when there is an abbreviated function, there is also, once again, a deficiency in the supportive structure of that spine that's abbreviating life supply, which is nerve supply, which we call life in this office. So what I'm going to do, Mary, as you're lying down there, I'm going to palpate your spine, which means touch, feel. Any area, I will adjust. What can you expect? Maybe a miracle, maybe nothing. But I just want you to know a force put into your spine to correct this vertebral subluxation. Now, I didn't use that word before because, Mary, that means misalignment in the chiropractic world. You don't have to remember it, but you'll hear it throughout this as you keep coming into this office. So then I'll adjust them. They'll get up off the table. I'll ask them a couple more questions. Usually the same old stuff. Did that hurt? How do you feel? I feel, well, that was different. I've never had that done to me before. Correct. But I want you to understand one thing. As life is motion, to create more motion in you, to create more life, it is a process. Nature is a process. Healing is a process. That's what we do in this office. We help you understand that everything around you is a process, so life and health and happiness is an everyday function. And in order to have that, you cannot have subluxations or misalignments in your spine because that will close off the expression of your life and your ability to give love to your loved ones or love to whoever. And that's what chiropractic is. That's what we do in here. Would you like to become a patient? I'll ask them, would you like to become a patient? I never had anybody say no. I've had them maybe after 3 or 4 visits not come back because I guess they're full of life now. But they never say no, because when you deliver that message with love and compassion, how are they going to say no? I mean, I try and keep it like, I don't know who said it today, Jay, keep it simple, stupid. I'm like Bobby Braille. I don't like to read a lot because it puts me to sleep, but I do read. And I'll read things that I can understand quickly because that's how my brain works. All right, so I try and portray that to my patients too. In and out, quick hit, quick hit, quick hit. And then I open that up to questions. And then I'll say, listen, you're a secretary or a legal secretary, whatever the situation may be, you have friends. They sit at the same desk, do the same thing that you do. Do you think they can benefit? This is the first visit. I'm asking for referrals because I'm here to serve and I'm here to help. Do you have any questions? No? Thank you. Go see Gloria. She'll give you appointments for the rest of the week. Thank you.